Aren't we all tired of listening to this? The kid does not want to eat. They're very picky about the kinds of food they are interested in. They don't want to chew. They don't want to drink from the straw. So many problems that kids have. More prevalent, of course, in children who have any kind of physical or mental health related issues like behavioral issues, or kids who fall under the autism spectrum. So today we are going to discuss how to deal with these kind of issues and make it healthy for our child to eat food and make them also interested in that. I am Prabhjot, an occupational therapist, spreading the word on rehabilitation. The first thing that we need to learn is, what are these kind of issues? What is this whole array of problems related to feeding that children face? First of all, very obvious ones. The drooling that some parents are really irritated by. The kid drools not necessarily during eating but otherwise also, which is also a kind of a food related problem, as the drool or the saliva that collects in the mouth is something that the child is not able to control well, and because of that it falls out of the mouth. Others is the kid is not able to swallow it, and very frequently the child tends to cough. The child has difficulty in biting the food, chewing the food. Basically from the tongue, the child is not able to take the food towards the side, so the kid will just sit and chew, and not necessarily even chew. Just let the saliva mix with the food, make it soft, and then swallow. A major problem that is faced here. Then even if the food goes towards the side, the chewing is not appropriate. Maybe 2 or 3 chews and then the kid tends to swallow again, sometimes chokes on the food, results in coughing, and the food not really going towards the food pipe but towards the windpipe. So what to do about these problems? Next, the food is made into a mesh, as I told right now. The child is just letting the food to get mixed with the saliva, not necessarily letting it become softer, become something we call a bolus, and then taking it inside. So that fine grinding of the food by the teeth is not happening. It could be, of course, because of dental problems also. So a dental recommendation is also necessary at times. Then the child may be gagging on the food. The tongue remains out of the mouth, again drooling associated with that. The mouth remains in a continuous open position, which is seen in a few kids with Down syndrome, kids with cerebral palsy, and sometimes even as part of the behavioral spectrum of the child. Other than that, the kid tends to pocket the food. If you know, you sometimes just push your kid's cheek. Eat, you need to chew from here. Why? Because the kid continuously has the food pocketed over here. Well, if it's for a few seconds and as soon as you remind, the kid starts to chew, and it happens once in a while during eating, that's good. But if it happens for a very long time, then it's an area of worry. Another problem that can happen is the kid's tongue movements are very restricted. The kid cannot take the tongue out. Show it to you. That also becomes a problem, means the tongue movements are limited over there. And also you feel that even as a child, children are really used to, especially during the dentition time, kids tend to chew on things, but your baby never did that. That can become an oral motor issue later. The kid is very specific about what they like to eat and what they don't. Extremely picky eaters. And finally, drinking issues. Drinking, of course, the kid is not able to take the glass. You always have to tilt the glass, and then the child is able to control the lips, close the lips around the spout or the rim of the glass, or drinking with the straw is problematic. The sucking movement is problematic. All of these come under the oral motor issues. We will discuss in the next video how simple therapeutic techniques can be applied to overcome these problems and make your child healthy.